Today we're going to be teaching you how to use an AED on an adult and an infant.
To use an AED, first turn the device on. Remove or cut away clothing and undergarments to expose the person's chest. If the person's chest is wet, dry it using a towel or gauze pad. Dry skin helps the AED pads to stick properly. Do not use any alcohol wipe to dry the skin because alcohol is flammable. Next, apply the AED pads. Peel the backing off the pads as directed, one at a time, to expose the adhesive. Place one pad on the upper right side of the person's chest and the other pad on the lower left side of the person's chest, pressing firmly to adhere. Plug the connector cable into the AED, if necessary, and follow the device's directions.
Everyone stand clear.
Clear.
Shock advised. Charging. Everyone stand clear.
Clear.
Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR. Remove clothing from person's chest. Attach pads firmly to person's chest as shown. Plug-in connector. Analyzing rhythm. Everyone stand clear. Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
We hope that you learned how to use an AED on an infant and an adult. Thanks for watching.
I wanna say